when we talk about cholesterol, statin drugs are very popular. There's many other prescriptions that are becoming more and more popular. You probably see patients that are on multiple prescriptions. What's the potential danger in that, as we age, to add another one, and then another one, and then another one, and then one to take care of a symptom from another one?
Yeah.
You know, to be on so many. What's the danger in that?
I think it's very dangerous. I mean, I think we call it polypharmacy, and that's exactly what happens, is that you get a couple medications for your clinical presentation, and then all of a sudden side effect or so pops up, and then you're all of a sudden like a whack-a-mole game, right?
Yeah.
So it's like, pushing here and punching there, and this goes up and this goes up. And a lot of times, sometimes increased dosages or different routes or what have you. And I think it's really because I think it's really dangerous, because what happens is we can't affect a cure. We can't. They become obstacles to cure. I think sometimes medications. And look, I'm the daughter of two pharmacists. My dad climbed the corporate ladder of a large pharmaceutical company my entire life, and I think that there's a place for everything I do. And I think some of these agents, when used appropriately, that they're just fine, but it's the long-term use, when there's no exit strategy, when there's no changing or understanding obstacles to cure, they actually become obstacles to cure.
Mm-hmm. Well, in a lot of those medications, people assume they're going to have to be on the rest of their life. What have you seen in your experience where people can at least reduce the amount of medication or the amount of medications that they're on?
Oh, when people put their mind to it, I mean, the body is completely amazing and resilient. And I have seen people come off of medications, not just reduced dosages, but from any really category. If you're talking about cardiovascular meds, cholesterol meds, antidepressants are a big one, pain medications, the purple pill and the proton pump inhibitors. We've got tools, to heal our bodies. We do. We just need to know a little bit more.
Mm-hmm. You touched on something else that I wanted to talk about before we go. The heartburn, indigestion meds. The commercials are on every 2 minutes, it seems like.
Direct to consumer.
Exactly. And those people are happy. They can eat anything they want if they take their purple pill. How damaging is that to the brain there,
I mean, just check that out. I mean, I think it's brilliant marketing. I do, because it's almost like, I'm not going to feel pain. When I ate this cheeseburger before and I felt pain, if I take this, I don't feel pain. Well, you also, though, are setting yourself up. Have the cheeseburger, but make sure that you're ready for the osteopenia, osteoporosis, for the gallbladder disease, and your gallbladder, eventually being taken out, because that's what's going to happen. If you look at the side effect profile of those agents, we need our stomach acid to absorb trace minerals. We need our stomach acid to break down proteins and help us digest. And if we just stop it from a pain perspective, pain is the body's, hey, there's something going on. So we get curious before we get our prescription pad out.